Many elements need to be considered by women, men, or couples at a given point in their lifetime when choosing the most appropriate contraceptive method. These elements include safety, effectiveness, availability, and acceptability. Voluntary informed choices of contraceptive methods is an essential guiding principle, and contraceptive counseling, when applicable, might be an important contributor to the successful use of contraceptive methods. In choosing a method of contraception, dual protection from the stimulation risk of HIV and other STDs should be considered. Although hormonal contraceptives and IUDs are highly effective at preventing pregnancies, they do not prevent against STDs, including HIV. Consistent and correct use of male latex condom reduces the risk of HIV infection and other STDs, including chlamydia infection, gonococcal infection, and trichomoniasis infection. Reversible methods of birth control: we have intrauterine contraception, levonorgestrel intrauterine contraception. The LNG IUD is a small tube device like copper T IUD. It is placed inside the uterus by the doctor. It releases small amounts of progesterone each day to keep you getting away from getting pregnant. The IUD stays in the uterus from 3 to 8 years, depending on the device. Typical use failure is 0.1 to 0.4%. Copper T intrauterine device. The IUD is a small device shaped like a T. Your doctor places inside the uterus to prevent pregnancy. It stays in the uterus for up to 10 years. Typical use failure 0.8%. Hormonal method: we have implant. The implant is a single thin rod that is inserted under the skin of a woman's upper arm. The rod contains progestin and that is released in the body over 3 years. Typical use failure 0.1%. Injection and shot: women get shots of hormone progesterone in their buttocks or arm every 3 months from the doctor. Typical use failure is 4%. Combined oral contraceptives, also called the pill. Combined oral contraceptive contains the hormone progesterone and progesterone. It's prescribed by the doctor. A pill is taken at the same time each day. If you are older than 35 years and smoke, have a history of blood clots or breast cancer, your doctor may advise you not to take the pill. Typical use failure is 7%. Progesterone only pill. Unlike combined pill, the progesterone only pill only has hormone progesterone instead of both progesterone and progesterone. It's prescribed by a doctor. It's taken at the same time each day. It may be a good option for women who can't take progesterone. Typical failure percent is 7%. Patch. The skin patch is worn on the lower abdomen, buttocks, or upper body. This method is prescribed by a doctor. It releases hormone progesterone and progesterone into the bloodstream. You put a new patch once a week for 3 weeks. During the 4th week, you don't wear the patch so you can have menstrual period. Typical use rate is 7%. Hormonal vaginal contraceptive ring. The ring releases the hormones progesterone and progesterone. You place the ring inside your vagina. You wear the ring for 3 weeks. Take it out for a week. You have the period. Then put in a new ring. Typical failure rate 7%. Barrier methods. We have diaphragm or cervical cap. Each of these barrier methods is placed inside the vagina to cover the cervix to block sperms. The diaphragm is shaped like a shallow cap. The cervix cap is treble shaped cap. Before sexual intercourse, you insert them into the spermicle to block or kill sperms. Visit your doctor for proper fitting because diaphragm and cervical caps come in different sizes. Typical use failure rate is 17%. Sponge. Contraceptive contains spermicide and is placed inside the vagina where it fits the cervix. The sponge works for up to 24 hours and must be left in the vagina for less than 6 hours after the last act of intercourse, at which it is removed and discarded. For typical failure rate is 14% for women who have never had a baby, 27% for women who have had a baby. Male condom. Worn by a man, the male condom keeps sperms from getting into the woman's body. Latex condoms, the most common type, help prevent pregnancy and HIV and other STDs, as do the new synthetic condom, natural or lambskin. Condoms also prevent pregnancy but may not provide protection against STDs, including HIV. Typical failure rate is 13%. Female condom. Worn by the woman, the female condom helps keep the sperms from getting into her body. It is packaged with the lubricant. Is available at drugstores. It can be inserted up to 8 hours before sexual intercourse. The typical failure rate is 21% and may also prevent STDs. Spermicides. These products work by killing sperms and come in several forms: foam, gel, cream, foam, suppository and tablet. They are also placed in a woman's vagina no more than 1 hour before intercourse. You leave them in place it at least 6 to 8 hours after intercourse. You can use the spermicide in addition to male condom, diaphragm, cervix cup. They can be purchased at drugstore. Typical failure rate is 21%. Fertility awareness based method. Understanding your monthly fertility pattern can help you plan to get pregnant or avoid getting pregnant. Your fertility pattern is the number of days in a month when you are fertile. Days when you are infertile. The days when you're infertile is unlikely but possible. If you have a regular menstrual period, you have about 9 to more fertile days each month. If you do not want to get pregnant, you do not have sex on those days that you are fertile, or you use your barrier methods of birth control on those days.